So thanks a lot for all the insights that you presented on Ayurveda in part one of the talk. It was really insightful and answered a lot. I'm sure it may have answered a lot of questions rather, not questions, but opinions that people have on Ayurveda. There are like two questions I had, like not me exactly. A lot of people, they think, first of all, that Ayurveda is a slow form of treatment. And I don't think in every case it may be slow. I mean, for me, in my experience, it had shown effects within 3 weeks. And I don't think that is slow for my condition. And second, Ayurveda, like this, it is kind of linked to the same question that it does not provide something as intensive as, say, surgery, like directly, uh, matlab, if like how you have certain tools in modern science and you have operative procedures. So, yeah.
Okay, now about time taken for treatments. Again, we have to come to the classification where the disease is falling under which category. If the patient is having Sukhasadhya disease, it will get cure easily. If the patient is having Kashtasadhya disease, the patient is going to take some longer time. If the patient is falling under Yapya category, the medicine has to go lifelong, along with all the dietetic restrictions and other things also. And if the patient is falling under Anupakrama, then there is no particular treatment or path of treatment. One. Secondly, when we say Ayurveda takes time, that particularly people say there is no emergency treatment in Ayurveda. Particularly, generally, people are having this kind of notion in their mind that
Yeah,
Ayurveda,
emergency treatment नहीं है.
yeah, इमरजेंसी हो तो हॉस्पिटल में ही जाना पड़ेगा. ये एक
हाँ,
जनरल बना हुआ है सर में. So it is not the case actually. See, I'll give you an example. If a patient comes to me and he is having breathlessness, but after checking him, if I feel no, the patient has to get admitted for oxygen supply, then I have to send the patient to the hospital. But at the same time, if I check the patient and if I see that the breathlessness is because of this particular reason, and I can treat that particular reason, then the breathlessness can be controlled. Okay. Now I'll give you two examples of this. One example is of modern science only. When I was there in my internship 20 years back, 20 years back, in Thane Civil, there used to be a set of people who used to come frequently after 10 days, 15 days. All were asthmatic as per modern science. And they used to come over there and they used to be like, Doctor, wo injection de do, saas phul rahi hai. And there was a protocol that those patients will come and the derifalin injection has to be given to them. So the derifalin injection is given, bronchodilation has happened, and the patient is happy. Now I can breathe. He goes away. After 10-15 days, he will come back. Okay, this is one example where you don't need oxygen. The simple derifalin is giving you a bronchodilation effect. This is an example of modern science. Now, as per Ayurvedic view, I'll give you a case where a patient called me at night saying, Doctor, I'm having breathlessness. And I asked him what happened actually, because he is not having any history of breathlessness, he's not having asthma, he's not having anything else. So he said, Ki, nahi, doctor, 3 hours back, I felt like having some bhang. It was lying in my house. I had my bhang.
Okay.
And this is like 18 years back.
Acha, okay.
So I asked him, okay, was the bhang old? First of all, he was like, I didn't check it. वो packing था, वो plastic के wrapper में आते थे, गोलियां आती थी पहले. So that kind of a thing was lying with me. I felt like बहुत दिन हो गए यार भांग नहीं लिया. थोड़ा सा लेता हूँ, शांत नींद होगी. हफ्ते भर बहुत भागदौड़ हुई है. So he took it. And after 3 hours, he called me saying, I'm having breathlessness. So that time, after talking with him, I said, okay, fine, I'll come. I went over there because he was a family friend. And what we did was we simply made kokum ka sharbat in hot water. And I told him, just take it sip by sip.
Kokum sharbat, like with the pulp that you get.
Yeah, correct. The market ready kokum syrup in hot water.
Okay.
So we prepared it. And we told him, just sip by sip, keep taking it. We were sitting over there for half an hour. We were chit-chatting along with him only. And after half an hour, he was settled down.
Okay. Acha.
Then me and my father came back.
Oh,
and we
okay.
slept. He also slept. This is another example. One example was derifilin. Second example is this. So if you can find out the reason, and if you feel that you can treat that reason, then there is no need to send the patient to the hospital. But you should be able to understand this particular thing. And there are n number of Vaidyas. I can actually show you how many Vaidyas are there who are actually treating so nicely all these kind of emergency treatment in their own clinics.
But are there operative procedures in Ayurveda?
I'm coming to that also. This
Okay,
is this
sorry,
is
sorry.
this is
I
one
thought
thing.
this was the same thing. Yeah,
No,
okay.
no, no. This is about the emergency treatment if the Ayurveda has
Emergency.
or not. The part non-surgical and surgical. These are the two treatments basically.
So
Coming.
when you said I'll send them to the hospital, it was like Ayurvedic hospital?
No, no. I gave you an example. I told you about if the patient is in need of oxygen, then I
Ah,
have an oxygen cylinder in my clinic because I am not running a hospital in-house OPD, something that kind of a thing. I am not having. So the patient
okay.
has to go to the casualty ward of any hospital
Okay, got it, got it.
just to get the oxygen supply. Okay. But if I can open his bronchodilation, if I open his bronchus, if I open his lungs, if I remove the obstruction, if I can find out the reason, then there is no need of oxygen supply. And it is a quick process. Now, another example is if a asthmatic patient is there and if he feels breathlessness at night, then many times we tell them कि okay ये गोली है ये ले लो तो उससे आपका ब्रेथलेसनेस कम हो जाएगा रात को जरूरत नहीं पड़ेगी बाकी कुछ चीज की तो वी गिव देम मेडिसिन विच दे कैन टेक इन इमरजेंसी बेसिस ओके so there are definite Ayurvedic treatments in emergency also in Ayurveda. Coming to the surgical point, one of the three ancient texts of Ayurveda, Charak, Sushrut and Vagbhat, one of them is Sushrut. He is called father of surgery even by modern science. Why? Because Sushrut Samhita is all about surgeries and the treatments which are to be given to the patients without surgeries and surgeries both.
Some context for this part of the episode. There are 14 Vidyas or Shastras or sciences and 64 Kalas or art forms in ancient Indian knowledge systems. Ayurved is one of the 14 Vidyas or Shastras or sciences, and Ayurved is divided into 8 subjects, which are explained as follows in the episode.
So Ayurveda has 8 subjects. Division of Ayurvedic treatment or rather Ayurvedic subjects is divided into 8. Kaya Chikitsa, I'll give you the shlok itself. Kaya Bala Graha Urdhvanga Shalya Daunshtra Jara Vrushan. Kaya is Kaya Chikitsa, is the physicians what they do. Bala is Bala Rog, pediatrician. Kaya Bala Graha. Graha Chikitsa is something different where I'll not go into deep because it's a debatable topic. I don't want to open any kind of those things, but yes, that is a definitely the definite subject which is there to be
astrological, is it related to the planets and
related to the no Graha Chikitsa is various kinds of Bhuta Badha and other things, but I will not
uh,
go into that because itself is a very vast topic. It will be like it will need at least 5 to 10 podcasts. So
but good to
I
know that Ayurveda is covering it.
Some context for Graha Chikitsa, one of the 8 subjects of Ayurveda. The word graha means external reasons which can take over or enter the human body or the human mind or both. These include visible and invisible reasons or objects. Examples may range from bacteria, viruses, different psychological disorders, poisons, to concepts like Dev, forces, Danav, Gandharva, Pishach, and more.
Kaya Bala Graha Urdhvanga. Urdhvanga is upper one-third body part or above clavicle, any body organ. That is one section. So where your ENT comes, your ENT, then ophthalmology comes, everything comes into that. Urdhvanga Chikitsa. Even your brain, your head, everything comes. Sensory organs will come under that category. Kaya
Mental
Bala Graha.
diseases, mental
Yeah,
diseases.
everything will come because sthan of man or mind, not soul. Soul and mind are two different entities as per Ayurveda. Mind, the location of mind is one location is hriday, that is heart, and second is bhru madhya on your forehead, and both the things come urdhva jatrugata. That means above your diaphragm. Everything is under that category. So kaya bala graha urdhvanga shalya. Shalya is nothing but surgery. Daushtra. Daushtra means bites. So various kind of bites, from a rat bite to a dog bite to a snake bite to a scorpion bite, any kind of poisons if are getting in your body or something is happening with relation to that, then that is called as Daunshtra Chikitsa. Then comes Jara Chikitsa. Jara Chikitsa is nothing but geriatric treatment. Old age people,
Old age treatment.
and Rasayan Chikitsa comes under that, and many other things comes under that. And last is Vrushan. Vrushan means the sexual angle of a human body, where all the aspects of sexology comes under. That is Vrushan. That this is how the classification of subjects as per the treatment are done in Ayurveda and are followed in Ayurveda. Now, Daunshtra Chikitsa and other things are not so commonly practiced in India now because too much knowledge is lost. But yes, if someone is interested, then they can visit many places in South India, where today also these kind of practices do happen. Okay, even tribal medicinal knowledge covers these kind of treatments. Very fantastic and fascinating treatments these Adivasis and tribal people, they do really have about these things. Unless and until you see it, you will not believe it.
Okay. Yeah, yeah. I've heard of
So
Adivasi
Shalya,
treatments.
yeah, correct. Yes, that is there in practices now also, but it is very in very shrinked manner, or very in particular pockets only they do it. So surgery is definitely there, and Sushruta Samhita itself classifies the diseases and explains the surgeries of those diseases. But Sushruta also precisely emphasize on one thing, that surgeries are the last option and are to be done in particular diseases only, where the medicines are really not going to help. Then only the surgery has to be done. Otherwise, doing surgeries is not a frequent thing. One should not go for that. Cutting your body open and removing parts and throwing away the parts is not particular thing. Same way, appendicitis, the appendix is a thing which people generally say, appendix ka problem hai to operate kar lo aur khatam karo. It's a useless part as per modern science in the body, vagara vagara vagara. Many things people talk about, but there are thousands of cases where appendicitis gets treated with Ayurvedic treatment and gets cured also.
Okay.
So first is the treatment. If the treatment is not going to help or is not helping, then the last option or last resource or resort we can think about as a surgery. This is what Ayurveda also believes.
Got it. So, in this particular talk, I wanted to address the inclusivity aspect in Ayurveda. In your bio, you have mentioned that your main research has been on non-vegetarian diet in Ayurveda. So that was something which was a little eye-opening, because a lot of people, including me, we seem to think that Ayurveda prescribes vegetarian diet. Like anyone who comes for treatment is prescribed a vegetarian diet, is what notion people hold when it comes to Ayurveda. So
yeah, many people have that kind of thinking about Ayurveda, that Ayurveda doesn't allow non-vegetarian food and all. It is not like that. Ayurveda says sarvam dravyam panchabhautikam asmin arthe. That means everything in this world is made out of pancha mahabhut, what is people nowadays called as five element theory. So everything is made out of these five things only, and that is usable whenever that is needed. So Ayurveda is very broad minded about this thing. And non-vegetarian food, yes, I did my MD post graduation on the, and non-vegetarian is advised by Ayurveda in three ways particularly. One, when Ayurveda says swasthasya swasthya rakshanam, that is, if a person has to be healthy, then Ayurveda helps him to be healthy. And to be healthy, if someone is in need of non-vegetarian food, is from the ethnicity where he consumes non-vegetarian food, then the non-vegetarian foods can be advised. If the disease condition is there and the non-vegetarian foods, various non-vegetarian foods are there, which are or can be used as a part of treatment, then Ayurveda definitely tells or advocates to use those things as part of treatment, either through the medicines or through the diet. So there are Ayurvedic medicines which are prepared from animal products. There are diets which we prescribe to patients with non-vegetarian. But again, it is fitted in those basic fundamentals where when the person should have it, how the person should have it, what kind of non-veg the person should have, along with the food, non-vegetarian food should be consumed, and more things. So it is used in three ways. One is as a food for a healthy being, then as a treatment part through the food or through the medicine in various diseases, and third aspect is can be used, or rather, yes, definitely can be used in treatments of even panchakarma.
Okay.
So people feel that panchakarma means you have to go somewhere, lie down, and someone will massage you with oils. Then you will take steam. Then some Vaidya will give you basti, some Vaidya will give you shirodhara or netra tarpan or something like that. All these things are part of Ayurveda or part of panchakarma, but the ingredients which we use for these various things, non-veg can be used as a material in these processes, where if I feel the patient is in need, then I can give chicken soup in a basti.
In
Basti
a
is
basti, as in not for consumption.
consumption through food is already I mentioned. I'm
Okay,
talking about
through basti,
can be
like
used.
through, okay, insertion. Okay.
Correct. So can be used in treatment as in panchakarma treatments as well if required. I can use chicken soup, I can use milk, I can use buttermilk, anything. If I feel that this is the need, this is the item which is to be used, then I will use that. So Ayurveda uses non-vegetarian category not only as a food but as a medicine, as a part of treatment or therapy also.
Got it.
One thing. Second is non-vegetarian food means people many times say killing an animal is a crime and all. I don't want to go into that particular aspect because it's totally different thing. But when there is no alternative, you can use this. If you have alternative, you will definitely not use this. Alternative should be of that level, or rather should be giving the same results.
Got it. Mm-hmm.
This is the aspect Ayurveda believes in.
Mm-hmm.
Because Ayurveda already has said that everything is five element is made from all those five elements.
Mm-hmm.
So we have n number of options. Whatever is best for the patient, whatever is best for the nature, everything has to be considered. Now, regarding this only, there is a mentioning of making of a hospital, Ayurvedic hospital in Ayurvedic texts, where everything is mentioned particularly in what direction, what kind of a department should be.
Okay.
So firework in this direction, water storage in this direction, this in this. This is not something feng shui or
I thought
astrology.
so. I thought something Vastu related.
No, not like that. Particularly, it is about the functioning ability of the hospital should be practical. But in that also, Ayurveda mentions that if you are going to use animal products, then there should be a section where the animals should be kept in a very nice and healthy conditions. Their feed, their medication, the experts who, the veterinarian Ayurvedic doctors who can treat the animals, that part also should be there in this particular direction. So that was an angle at that time also, or rather only that time. Now it is lost. Same way, there is no need of cutting or killing an animal every time.
Right.
For example, I'll give you an example of a subject of a substance which is banned now, but it's an interesting topic basically. Coral.
Coral. Ha.
Coral, which we use in rings and all.
In our community, they wear it in Mangalsutras. Yeah.
Exactly. So that is one thing. Second is deer horns. Okay. Now, to get the deer horns, the poachers kill the deer. But every year in Sharad Rutu, we are sitting in October right now. It's really not started yet. But in Sharad Rutu, every year the horns get so bigger that the deer cannot run at that great pace because of the weight on their head. So what the deer as a natural instinct do, they stuck their horns in big tree branches and they break them.
Okay.
So people earlier should go to used to go to jungles and used to collect the herbs. Along with that, they used to collect these horns also. So there is no need to kill the animal.
Kill the animal.
It is altogether a different story that poaching and everything is so much advanced nowadays that these aspects are coming into the picture with that angle. But this was an angle earlier that was in practice. In my childhood, I had seen a deer horn in my house. My grandfather had to. So small pieces he used to give to particular cases of respiratory system diseases where the it has to be rubbed on the stone with the water or milk or whatever, and the paste the patient used to consume. That old deer horn was there somewhere in my house. In my childhood, I had seen it.
Okay.
But the concept is not to kill the animal. Concept is to use whatever is best for the patient in that particular condition. Again, if you have an alternative to it, best. If you don't have an alternative to it, see, or rather be responsible that the deer will not get killed. Nowadays, so it's out of question because government has already banned it. So even if a forest officer gets some deer horn, he has to pick it up, has to take it and burn it, or otherwise he has no right to touch it. It has to lie down in the jungle itself. It will rotten over there. So that's a law now. It's a criminal offense to collect anything like that from the jungle. But this was connecting to that topic of non-veg which we were discussing. So I
Yeah, the
particularly mentioned
inclusivity
about.
aspect, right? So
Correct.
no, but then because you mentioned this, I know we are digressing a bit from the inclusivity aspect, but it struck me just now that does animal testing take place in Ayurveda for
No,
formulations and stuff?
no,
No,
that
right? Okay.
concept is not at all there.
Okay. Okay.
Concept of testing a medicine,
On
the basic
animals, yeah, it is doesn't
no
make
no the
sense.
process of Ayurveda of testing the medicine is altogether a different. You don't even need to test it on a human.
Right. The science is different.
Yeah,
Yeah.
fundamental processes of Ayurveda are mentioned in such a way that yes, it is going to be like that. It is going to you are going to make it like that. The best example of that is many people say about the heavy metals. Ayurvedic medicines have heavy metals, ये वो and बहुत कुछ होता है. 25 साल से people are talking about heavy metals and all. It started somewhere 25,
I
30
was
years
going to
back.
ask in that side effect section this same thing, lead,
Yeah.
arsenic, and mercury, but we can discuss it. Yeah, yeah.
Yeah, correct. So the processes themselves are so precise that the conversion of that molecule into something which is easily adaptable and acceptable by the body will go inside, will do its own work, and will go outside the body is so fantastically placed in Ayurvedic text that all those things are visible in our practices. The definition of medicine itself, definition of food and definition of medicine itself in Ayurveda is like this. Food is something which goes inside the body, gets converted into body forms and stays in the body. And medicine is something which goes inside the body, does its own work and goes outside the body. These are two definitions of food and medicine as per
Medicine.
Ayurveda.
Okay, got it.
Okay, this is how Ayurveda deals with every subject.
Got it. So inclusivity aspect, there were like two, three more questions. Like one is a I know it will sound a little surprising to you, but some people seem to link Ayurveda to religion. They think Ayurveda is Hindu. Okay, this is a
Hmm.
little. I know it's a little surprising, but there are people who think that Ayurveda is Hindu, and there are now it's very common for Westerners to follow Ayurvedic concepts. It has become pretty popular out there now. But I had a question that do these fundamentals work for those ethnicities as well? Because they were invented, or rather established here in India. This is a question I had. And about the religion thing, that's just something that people tend to believe, that there is a religious component involved. So this is something I wanted to address.
Okay. Interesting subject, or rather interesting question it is. If we see what is going on in the nation on the name of religion, Ayurveda, again, as per the text, not from my mind or anything which I am making out of, Ayurveda particularly says, Sar Ayurveda Sarva Dharmeshu Madhyamaha. That means Ayurveda does not treat humans based on religion. For Ayurveda, human is a human and it has to be treated as a human. But the angle, when the people say Ayurveda is a Hindu thing, it is not a Hindu thing, it is ancient Indian medical science. I will put it in that way, ancient Indian medical science. Because all Ayurvedic texts mention about Ishwar,
Mm.
Niyati, Yadricha. Then Ayurved mentions about Brahma, Ayurved mentions about Indra, Prajapati. So Ayurved is from the Bharatvarsh, and Bharatvarsh is of Hindu, or rather Bharatvarsh is known as a Hindu Rashtra. But Ayurved, when it comes, Ayurved says we, when we treat, we don't see any religion as a hindrance. Rather, I would rather particularly mention about these things that few people come and they say, if your medicines sometimes smell like cow urine, we will not be able to consume it. So that time we have to tell them, sometimes the medicine might contain the processes where the cow urine is involved, but sometimes the medicine or the molecule which is used is actually of the smell something similar to cow urine. Just to name one is Shilajit.
Okay. It
So
smells like cow urine.
pure Shilajit will smell something similar like cow urine.
Acha, okay.
So these are misconceptions. Now,
Uh-huh.
non-veg. When non-veg is there, Ayurved mentions about non-vegetarian foods, where Ayurved mentions about properties of pork meat, properties of beef, then properties of what not, properties of everything.
Hmm.
Okay. So Ayurved doesn't classify these things on based on religion.
Hmm. Right.
Okay. So Ayurved sees human as a human, treats human as a human. Religion is a practice one can follow in his own life, and that is his personal right. But when it comes to treatment, religion is kept outside the door, and it should be kept outside the door. That is what Ayurveda strongly believes in. That's why it says Ayurveda Sarva Dharmeshu Madhyama. It's a slok from Vagbhat.
Okay. Okay. And so it works for all ethnicities as well, because it
Yeah,
was
it is for
established
all
in India.
ethnicities.
So, okay.
Yeah, it is for all ethnicities. It is not about only, it will only work on Indians. It will not work on people from UK or from US, or from Uganda. Any person from anywhere the world who is a human can get benefit out of this. Rather, I would say, Ayurved, the subject, the knowledge of Ayurved has come from gods. So that means Ayurved is used for humans. Before this, Ayurveda was used by gods, and at the same time, Asurs were also there, so they were also using it. We know the name Shukracharya.
Hmm.
Shukracharya is a Vaidya of Asurs. So it is already there everywhere. It's a knowledge. Ayurveda is a part of Atharva Ved.
Atharva Vedya hai.
Yeah, it is a part of or extension of Atharva Ved. That's what it is called. Because Atharva Ved also has these kind of multiple references about herbs and their usage and all. But that is there in even in Rigved, even in other Samved and all. But Atharva Ved extensively talks about that. So it is said that Ayurveda is a extended part of Atharva Ved.
Hmm.
But that doesn't mean that it will not treat any particular kind of religion, or it will only treat
Yeah,
Hindus.
yeah,
It is
yeah.
not like that. Ayurveda
It is a
treats,
notion people have, but
yeah,
yeah.
Ayurveda treats every living being rather.
Hmm.
So that there in my one of the hobbies also in my biodata you had read and you were talking about that.
Yeah, yeah, yeah.
So Ayurveda is not only for humans; it is for every living being. Rather, I would put it in that way,
Hmm.
because as per my hobby also, I treat humans, I treat animals, I treat birds, I treat fishes, I treat plants on my farm with Ayurvedic medicines.
Hmm.
And not only herbs, I have even used heavy metal medicines on plants. heavy metal medicines on my dogs, my plants, my animals, my
Yeah,
birds.
I read that as one of the points on your on your portfolio. But I used to think the animal part was for testing, which you clarified that no.
No, no.
Yeah,
It is about treating
it is
every
treating,
living
treatment.
being. Yeah, it is about treating every living being through Ayurvedic knowledge system. That's my hobby, so I keep doing it basically. So
So
I
it
till now
means that there
I
is a
have
veterinary department also, like Ayurveda
yeah,
has.
there are ancient texts named as Gajayurved, which deals with health of an elephant. There is a text called Ashwayurved, which deals with health of
Horse.
horses. So there are literatures about that. When we say Daushtra Chikitsa, the 8 subjects of Ayurveda, I said, where the bites are there and all. There we have to, if we are treating the bites and the poisons of those animals, we have to understand what are those animals
Mm-hmm.
and the diseases of those animals. If we are
Mm-hmm.
having a cow in our house, we should know what are the diseases of the cow, and we should be able to treat it with Ayurvedic medicines.
And I think previously humans used to live with animals and treat them as family members of the house, like cows, for instance. So that
Nowadays,
naturally, I think that naturally came from there.
yeah,
Uh,
it is there now also. People used to have cows and buffaloes and horses and many animals in the house. Nowadays, people have pets in the house. So it has
yeah.
not changed. It is a human notion. It is a human emotion rather. Few people, or rather many people, love animals, and same way many people fear animals. So it's a part and parcel of a human life. It's an emotion. So people used to have animals. People used to treat animals before also. People nowadays also have animals, and yes, we definitely treat animals also.
So another question on inclusivity was related to transgenders, because you treat males and females differently, right? Based on their hormones, or I don't think for Ayurved there is a label called hormones. I don't think so. But in any case, you treat Purush and Stree differently in Ayurveda, I guess. So where does transgender fit in, and does it?
See,
So
the concept of male, female, transgender, whatever is there, human body is human body. Anatomically, it is different. Chikitsadhikrut Purush is the term which is called by Ayurved, which physical form along with the soul, when is mixed, that means living body, is the subject which Ayurved deals with. And that covers male, that covers female, that covers transgenders, natural forms, converted forms. This is the extension going on now. It's a hot topic nowadays. But when Ayurveda says it treats every living being, that means it treats every human, every living being. So I know people who Ayurvedic doctors who actually treat specialty is AIDS, and in their OPD, many transgender come.
okay, okay.
Okay, so that's the specialty they practice in. So people over there, yes, they definitely go over there and they get the treatment.
Okay, got it. Coming to side effects of Ayurveda, like you've already stated in between about the metals, this is something which most people have, that lead, arsenic, and mercury रहता है in Ayurvedic formulations, and over time they may lead to kidney and liver failure and things like that. So, is it really true that if somebody has Ayurvedic medicine for an extensive period of time, is the composition of metals above the safe levels, or I know that now that you clarified that these metals undergo a purification process as prescribed by Ayurveda, so they must be safe. But what about the amount?